Welcome to this webinar. This is a co-produced event delivered by the Bucks Send Information Advice and Support Service, which provides impartial and arm's length advice to parents and carers and is sponsored by Families and Carers Together in Bucks, the forum of parents and carers with children and young people with special educational needs or disabilities working to ensure that the views of families are instrumental in shaping services. This is the fourth of a series of webinars we will be delivering over the next year, aimed at increasing parent and carer knowledge and abilities to engage with SEND system. More children and young people receive support they need to achieve their potential through SEN support and through education, health and care plans. So it is vital that we are well informed about what support we can expect and how we can access it. This webinar will be recorded. The slides will be clickable links to useful websites and recording will be shared with you in due course. These will also be available on the FACTBucks website and the SENDIAS web pages, details of which will appear at the end. You will have noticed that you are automatically muted. Only the presenters will speak. Questions are encouraged. You will be able to type your questions in at any time and we will try to answer as many as possible at the end of the session. Please keep questions as general as possible. Questions about individual children are best asked privately via SENDIAS online contact form available on their web pages. Questions will be moderated before they appear, which may take a further few minutes. We will collect together all the questions and share answers with you as soon as we can after the session. So if we run out of time today, your questions will still be answered. A tip: if you are having any kind of connection difficulty as you join the session or during it, try logging out and starting again. If this does not clear up the problem, you will be able to access the recorded version of the webinar in due course. Today's webinar will be presented by myself, Tracy Campkin, SENDIAS Advisor, and Caroline Hart, the Designated Clinical Officer. So this webinar is aimed at improving your knowledge about what is available in Buckinghamshire to support your child's health needs and in improving your confidence to make the most of it. We will be covering the topics on this slide with the aim of improving your confidence in navigating the health system. So we'll be looking at parents with views, parents with skills, NHS Constitution, health services in Buckinghamshire, medical terms, getting the best from appointments, identifying health needs, health EHC plans and annual reviews, preparing for adulthood, resolving disagreements and influencing local policy. We will have all used the NHS. Some of us will have had good experiences, some less good. We hope today will show you how you can get the best from the system. Your views as a parents and carers are very important and do count. So firstly, see how this is written in law. The underpinning principles of the Children's and Families Act is that the local authority and other relevant organisations such as schools must have regard to the views and wishes of the child, young person and their parents. So looking at the blue boxes, the views, wishes and feelings of the child and their parents or the young person. The importance of them participating as fully as possible in decisions. The importance of them being provided with the information and support necessary to enable participation in those decisions. The need to support them in order to facilitate the development of their child or young person and to help him or her achieve their best possible education and other outcomes. We call the words in these blue boxes the Section 19 principles because they are from Section 19 of the Children's and Families Act. The local authority must make sure that children, young people and their parents and carers are involved in the decision-making process as fully as possible. It's important to stress that this is not optional for the local authority, it is a duty. What did you do before you had your children? What skills did you develop? Often we forget that we have not always been parents or carers. Think about all the things you do for your child now. Generally, a parent of a child with SEND will be doing more than a child of a non-disabled child at every comparable age, and probably this is more of a contrast as they get older. What skills do you use now as a parent? When you are facing conversations with individuals who are in their small field experts, remember that your strengths come from the breadth of your skills and the extent of your experience. You may recognise yourself in having some of these roles. You may have other roles that you can think of. Think about all the knowledge, skills and expertise these tasks give you and how you support your child in many different aspects of their lives, typically more intensively than other parents will need to do. Often, what might be the simplest of tasks for a parent of a non-disabled child will require a high level of planning and skill from a parent of a child with SEND, such as a trip to the shops or to the park. So you have more expertise than most parents. You also have expertise which professionals don't have. You know your child best. Most professionals have expertise around a specific difficulty, such as a hearing difficulty. They don't know how your child is impacted by their difficulties as well as you do.
People often talk about health, which covers a multitude of areas. There are different entry points. Some will start with a GP, but others will be reached through school or self-referral, such as CAMS. There are a number of people who might be in the team working with you and your child. The more complex the need, the more people likely to be involved. The diagram in the slide illustrates how the health service is a complex landscape. You may be more familiar with some of the services than others. Just to add, as I will talk about later, the different services may be provided by different organisations, such as CAMS, which is provided by Oxford Health, and Paediatricians, which is provided by Buckinghamshire Healthcare Trust, and they will use different record systems. So whilst the information is stored as an electronic patient record, it does not mean that they can each view each other's information, such as reports or clinic notes. GPs also use a different system. It is therefore important to request reports are shared with relevant services working with your child. The NHS Constitution is the government guidance that outlines the core principles and values of the NHS in England. Reviewed every 10 years, it sets out rights to which patients, public and staff are entitled. There are key principles which are underpinned by values and rights and pledges which the NHS is committed to achieve. It is aimed at making the NHS fair and effective for all. As you can see in the slide, examples of principles are accessible to all, free at point of delivery, patient-centred and offering value for money. Values such as dignity and respect, quality of care, compassion and equity of access. Rights are the legal obligations in regard to access and quality of care, and the pledges underpin these and provide the commitment to provide comprehensive, high-quality services. All NHS bodies and private and third sector providers supplying NHS services are required by law to take account of the Constitution in their decisions and actions. It also works that staff have the right to be treated with dignity and respect, as you will sometimes see on posters in hospital settings, particularly A&E. The overall responsibility lies with the government body, the Department of Health and Social Care, which is composed of 28 departments, including NHS England and the Office for Health Improvement and Disparities, which was previously Public Health England. The Department of Health and Social Care sets the overall budget for the NHS. Most of that funding is passed to NHS England and NHS Improvement to provide health services. The remainder is allocated for spending on other health-related functions, such as public health, including grants to local authorities, training and development of NHS staff, and regulating the quality of care through the Care Quality Commission. Funding and responsibility for most healthcare functions such as A&E, CAMS, therapies, orthopaedics is delegated to the local CCGs and local authorities, with some specialist services remaining commissioned by NHS England. GPs are co-commissioned between the CCG and NHS England. Our local CCG is Buckinghamshire CCG, who buy services from our local NHS providers with some additional support from voluntary sector organisations such as Barnardo's. The local authority, Buckinghamshire Council, is responsible for buying public health services such as health visiting and school nursing and sexual health, as well as the integrated community equipment store, which provides specialist education, health and care equipment such as specialist seating. Health and Wellbeing Boards bring together the NHS, public health, adult social care and children's services, including elected representatives and local health watch, to plan how best to meet the needs of the local population and tackle inequalities in health. Not forgetting the organisations that regulate and provide advice and support, such as Health Watch, CQC, who regulate care, and the Ombudsman, who will deal with complaints that have not been resolved by NHS England. So thinking about this in the context of a particular child, such as Edward, the inner circle shows the range of services that he and his family might use. The next circle shows who is responsible for commissioning these services, while the outer circle shows the Health and Wellbeing Board, which has strategic responsibility for making sure that the right services are available locally for all families. Moving on from the national picture, locally we have Health and Wellbeing Board. These are a statutory function. The board meet publicly 4 times a year, which you can watch, and serve the role of ensuring collaborative approaches to health and wellbeing across organisations, with a focus on ensuring equitable access. Buckinghamshire CCG is a group of 48 member GP practices and their associated branches across the entire county, serving a population of over 530,000. These practices are divided into 13 primary care networks, or PCNs. PCNs were launched in 2019 and were developed to facilitate closer working across general practice, social care, mental health and voluntary community groups to enable care closer to home and more efficient use of resources by reducing duplication in support and specialist services. The aim is to benefit both patients and surgeries alike. Some of you may be aware of the PCN involvement in delivering COVID vaccinations. Buckinghamshire Council, as you will be aware, Buckinghamshire Council has many functions for the point of view of this presentation. The key ones include hosting the Health and Wellbeing Board, and also it hosts the team responsible for commissioning a large number of the public health and children's health contracts and a few of the adult contracts. Just to know, it's expected from July 2022 that the local CCG will cease to exist, as it will become part of the integrated care system across Buckinghamshire, Oxfordshire, Berkshire West, to be the Bob ICS, and you will sometimes heard that spoken about, the Bob ICS. Some work has already commenced to move to this. It is anticipated that some level of commissioning will remain at place level, i.e. county level. Another term that you may hear used is integrated care partnerships, which look to draw together services to deliver care in a collaborative way. They comprise of healthcare providers and local authorities working together to deliver coordinated care to a particular group of people. For example, in Bucks we have the mental health ICP, which brings together partners to discuss issues and developments and review performance. The CCG commission or buy services mainly from our local NHS trusts, which employ our health teams. There are 5 providers across Bucks. These are Buckinghamshire Healthcare Trust, which is services like Paediatricians A&E, Oxford Health, who deliver CAMS, adult mental health services and continuing care, HPFT, which is Hertfordshire Partnership Trust, who provide adult learning disability service, and some people who live in the south of Bucks may use Berkshire Healthcare or NHS Frimley Health Foundation Trust. So Frimley provide the healthcare for Wexham Park Hospital. BHT are the main healthcare provider in Bucks. Sorry, next slide, please. BHT are the main healthcare provider in Bucks with 3 main hospital sites, but they also deliver care across community bases, schools and at home when required. They have a large contract with the CCG to provide services such as orthopaedics and A&E, and are jointly commissioned across the CCG and Buckinghamshire Council to provide children's therapy services, and Buckinghamshire Council to provide school nursing and health visiting and other public health contracts. The service is delivered by a range of professionals with a large number of appropriately trained support staff to help in delivery of the services. The link in the slide takes you to the web pages for BHT Children's Services, where you'll be able to find out more information. Oxford Health NHS Trust provide mental health services to children and adults in Bucks, and similar to BHT, use registered staff and support staff in delivery of care. Oxford Health hold the CAMS contract in partnership with Barnardo's and also work with other voluntary and community organisations. They deliver CAMS services across their 2 main bases, Harlow House in High Wycombe and Sue Nichols Centre in Aylesbury, and have offered increased access digitally since the beginning of the pandemic. Adult services include Healthy Minds and adult mental health services. The service have a single point of access and takes self-referrals and offer consultation. A 24/7 helpline was established during lockdown for urgent needs and can be reached by calling 111. Oxford Health also have the contract for delivery of continuing health care for adults and children. I'm not going to go into detail about all these services, there are links in the slides, but in brief, the services supporting and advising in Buckinghamshire. Health Watch Bucks. Health Watch on services which can then be fed back into decision makers and commissioners to influence change based on that feedback. Their role is to ensure that health and social care services put the experience of people at the heart of their work. The Advocacy People are an independent advocacy service who support people across Bucks. They will support people to have their say in how they are cared for and supported and in making complaints. PALS, the Patient Advice and Liaison Service, is a free and confidential service for people who would like information about on any aspect of the service provided by the health service. There's a PALS service for the CCG and each of the healthcare trusts. The above link is to the BHT PALS webpage. If you have a complaint with the service, if you feel able to, it's always best to raise it directly with them, as they will be able to address your concerns directly. Whilst no one likes to receive a complaint, we appreciate this is how services improve. SENDIAS, who Tracy works for, would be covered later in the presentation. And lastly, the Designated Clinical Officer for SEND, which is my role. So I'm Caroline Hart, and I am the Designated Clinical Officer for SEND in Bucks. Fairly new in post, but some of you may know Sarah Tilston, who was previously in this role. My role is to ensure health service engagement in the special educational needs and disabilities process, from identifying needs to providing support. I work closely with the commissioners and providers of the services and the integrated SEND teams, including the Educational Health and Care Coordinators, the ECHOs. As the DCO, I'm part of the team providing quality assurance across the health and care and education, health and care process, linked with the local health systems as required. I've talked about a range of services that offer different levels of care and use different terminology or language. On the slide are 3 different sets of terms that you may hear used to describe the levels of care. Primary, secondary and tertiary. Primary are services such as GPs, pharmacists that are available to all. Secondary are the hospital and community care services such as fracture clinics and diabetes nurse. Tertiary are highly specialised treatments such as neurosurgery, transplants and secure forensic mental health services. Moving down, we have universal, targeted and specialist. Universal again is available to all, such as health visiting checks. Targeted is normally a brief intervention or help with a particular concern, which may be initiated by the key professional but completed by a member of the wider team, which could be the school, therapy team or parent carers following specific advice. A specialist might be one-to-one and would include something like a specialist chair assessment or a particular psychological approach. The terms you may hear in CAMS are getting advice, getting help, getting more help and getting risk support. Getting advice is the universal part. Getting help is similar to the targeted, so things like the mental health support teams who deliver mental health support to schools across the county. Getting more help with the specialist services. Getting risk support is the crisis response, which in Bucks we have OSCAR, outreach services for children and adolescents. Across the levels of care, except perhaps tertiary, maximum benefit will be gained when the practice is applied through everyday living, not just therapy sessions.
Notice how we may use different terms for children with disabilities compared to those without. As parents, we have to be aware of the language of professionals as well as how that relates to the lives we actually lead. Next slide, please. So you can use language wisely to get what you want, depending on the situation you are in. Professional language and terminology can have its uses, such as when discussing a child's needs with professionals or when filling out a form or making a request for an EHC needs assessment. It can help to show you are knowledgeable and know what you want. But this use of language could confuse or distract others who do not have your expertise. In any situation, don't assume understanding. For example, you may need to explain a condition and what its impact is on your child in simple terms to get your message across. Also, we should be aware that using these terms when your child is with you may have a negative impact on their self-esteem, as they may concentrate more on their needs or diagnosis and help they need, not who they really are. Getting the best from your appointments. Let's think about how medical appointments for your child or young person, whether it be with a GP about something routine or with a specialist consultant investigating a diagnosis, providing an assessment or reviewing care perhaps. Are you clear about what the appointment is for? What might happen at the appointment? Do you know what you want from the appointment? What would help you to come out of the appointment feeling that you are worthwhile? Next slide, please. The advice that you think about what these things before, we advise that you think about what these things are before the appointment, if you can, and you know what you can ask and what questions, such as, what are my options? What choices do you have? What are the benefits and risks of those options? What are the advantages and disadvantages? What's the likelihood of something happening? What are my preferences? How will all of this work best for me and my child? And what help do I need to make my decisions? So is there anything else I need to know? Do I need to speak to someone else or have information put in a different way which helps me, such as simpler language? This video clip is of adults talking about their own health appointments, but the same principles apply for parents going to appointments for their children. Remember, you can ask questions. There is even an NHS campaign about this.
Just ask.
Well, just ask.
What are my options?
I like to know everything that's available.
The big thing for me is that there were a number of choices.
If you know you have options and there's other avenues you can go down,
then I feel really comfortable.
None of this is possible unless I'm happy and prepared and feel confident enough to just ask the question.
Each of the options you discuss will have its pros and its cons. Try and get a better understanding of each of these. So just ask.
Could you tell me about the benefits and any risks?
Asking about the risks and benefits, I think, really helped.
I explained the situation. The doctor gave me a sheet with options on and the pros and cons of those options.
Now that I know about the benefits and the risks, I feel more in control of my decision.
It's not just about understanding the benefits and potential risks of your options. The likelihood of each also matters, so just ask.
what's the likelihood of those happening?
She talked through the likelihood of the negative things happening.
She showed me the figures and the facts.
It was quite easy to go through the percentages that were there. It was helpful.
When you've got all the information you need, it's time to decide what's right for you. What are your preferences? What matters most to you? Just ask.
So how do we make a decision together that's right for me?
He doesn't know what's right for me or matters to me unless I tell him.
Unless he knows what's important to me.
It was good because I felt like I was sharing the decision with my doctor.
Making the decision hand in hand with a doctor was the best decision I made.
Whenever and wherever you see a healthcare professional, at the surgery or clinic, in a hospital, or even at the pharmacy, it's okay to ask more questions.
When you hear bad news, it's really easy not to listen, so it's very important to ask the right questions.
To make the right decision, you need the right information.
So just ask.
So just ask. So just ask.
So how do you make sure that you know what your child's health needs are and if they have any, and how to share them with others? Keep your child's red book safely. This will have been given to you from birth or passed on to you as an adoptive parent or a foster carer if it's available. It is for you and the professionals to record the developmental checks and the appointments, for example, so it can be very useful to refer to. For example, to remember the date your child said their first word if they were able to do so. Does your child have an individual healthcare plan to manage their day-to-day healthcare needs at school? It contains details of their medication, their key contacts, the regime of care, for example, timings for medication or care, what to do in an emergency for the child. It is usually written by you together with the school and with health professional input. It should be reviewed at least termly. For some children with complex medical needs, it could be more often. If your child has an education, health and care plan, this should be referenced in section F. What about a health passport? I've included an example on the link. These are for you to fill in. These are very useful to share with your child's healthcare needs and preferences with others. For example, if they need to go into hospital, among other information, you can include how your child prefers to be communicated with and what might motivate and encourage them and what to avoid because it might upset them. Your child might have a diagnosis or may be waiting for one. Your child may not need one, but remember it is not necessary to have a diagnosis to be provided with special educational help. It is also not necessary to have a diagnosis to meet the definition of disability under the Equality Act 2010. Assessment reports are documents written up after a professional has investigated your child's needs. The assessment identifies the needs, measures them, and often suggests suitable support for your child. You may have one if your child has been treated by CAMS, the Child and Adolescent Mental Health Support Service, for example. Any reports like this will be useful to share with your school if your child also has an SEN support plan, which gives them extra help at school. There are a range of these included in the Education, Health and Care Needs Assessment, including from health professionals such as a GP or a paediatrician, or perhaps from relevant therapists such as an occupational therapist. As part of the EHC Needs Assessment, you will be asked to complete a health questionnaire. This is because the best person to know about your child's health needs and any professional help they are currently getting is you. Children and young people are the experts on themselves and should be encouraged to speak up in appointments, contribute their views and take responsibility for their care from an early an age as possible. The health questionnaire finds out whether the child's healthcare needs are already being looked after by any health professionals and asks for information about medications, allergies and whether your child has an individual health care plan, for example. You can also use our SEN cards if you have them to identify your child's needs. These were co-produced by Bucks, SENDIAS and FACTBucks with local health professionals. Each card includes a special educational need as a cartoon on one side and a description on the other side, including professional terms for special educational need, what it means for the child and possible reasons for it. We are hoping to make these available digitally on our web pages soon. So health on an EHC plan. The next few slides are relevant if you have a child with an education, health and care plan known as an EHC plan. You will find that health needs and support are mentioned in several sections in the plan. Section A of the plan is about what you and your child think about their special educational needs. As part of this, you should have been asked to complete the health questionnaire as discussed. Information you give may be included in Section A. Section B describes your child's special educational needs, including those which are caused by their health issues. So, for example, your child may have difficulties with fine motor skills, such as holding a pen, and gross motor skills, such as walking and running. These should be listed separately in Section B. If a need is identified in Section B, then there must be a provision to meet that need in Section F of the plan. Section C should include the impact of the health needs. Are they causing any barriers to education or life in school? It should state whether the child is waiting for a health diagnosis or assessment of any kind. If there are no health needs in Section C, it should state no identified health needs. Section E, the outcome sought for the child or young person. What we are aiming for the child or young person. The benefit or difference that the help in Section F will make. Even for children with no health conditions, there should be a health outcome on their plan as they get older to make sure thought is given to how the child will access health support and keep healthy as an adult. Section F is the help that meets the needs. This will include therapies where they educate or train a child or enable them to access education. So if the child needs to learn new strategies or skills relating to their health needs, for example, if the child requires speech and language therapy, whether or not this requires direct therapy from a therapist. This will usually be in Section F because the child is learning a new skill. Another example might be cognitive behaviour therapy, because the child is learning new skills to help them to cope with their difficulty. Other medical help may not be in Section F, for example, medical treatment during a long-term illness, where the child might be receiving medication or care, but they aren't being educated or trained in any way to deal with it. In this case, the help would be in Section G. Section G, if the child has an individual healthcare plan or has been prescribed glasses, this should be mentioned here. Section J is for information about any personal budgets, including personal health budgets, for example, children requiring continuing care. There is a link at the foot of the slide with more information. Section K, this is the list of reports used to make or change the EHC plan. Any medical report should be listed as an appendix. The IPSI checklist is useful to help you to make sure the EHC plan is complete. The leaflet Securing Health Advice for EHC Plans gives more details on the information in this slide. It is aimed at professionals, but it may be useful to look at it if you have any further questions. You will receive a health questionnaire as part of the annual review paperwork. If your child has recently had an EHC needs assessment, this questionnaire will look familiar to you as discussed. The questionnaire will make sure that you have a chance to report on what happened in the last year regarding your child's health. It is a reminder to send in any new health reports and to make sure your child is having regular eye and hearing checks. Has your child's medication changed? Do they now need an individual healthcare plan to manage their day-to-day healthcare needs at school? Have the medical professionals involved changed? If you aren't given the questionnaire, remind your school about it. It's easy to find on the Bucks School web. There's a link to it here. Preparing for adulthood. So when should children start to take responsibility for their own health needs? Basically, as soon as they can. There are no hard and fast rules. Relying on others for everything, especially when they are older and you might not be able to be with them all the time to help them, can be very restrictive. Often they won't be able to take on the full responsibility. Some will never be able to. The important thing is to give them the chance. Take advice on timing, breaking things down into very small steps. Explain to your child the reason why this is or the actions that are being taken to keep them healthy and why that it's part of growing up to do more for themselves as far as they are able to, like learning to cook or to wash their own clothes. For example, if they are having physiotherapy exercises, can they be relied on to do them themselves? Can they move from being reminded every day to have their medication to remembering to take it themselves? How can you help them to achieve these small steps? What will work for them? The simple satisfaction of having more responsibility or some kind of reward chart to treats. This video is from another clinical commissioning group. It tries to show why it is important to plan moving from children's to adults' health services and not leave it to chance. Your child may have more needs than the young man in this video. Even so, there may well be small steps which they can be helped to take to increase their level of independence and ability to choose their own care. It will take planning and effort from the young person as well as the adults around them, but it will be worth it.
Hey you, how's things?
It's alright. Wish I didn't have to rely on you and Mum all the time to take me to my clinic appointments.
Enjoy it whilst it lasts. Wait till you're 18 like me. You'll probably be doing all this health stuff yourself.
Well, I can't wait till I can drive. Anyway, what do you mean health stuff?
When you're 18, you're legally an adult. That means you're going to adult health services, and that means changes. Changes to where you go, changes to who you see, no more Dr. Russell. Changes are transitions. Haven't you got a transition plan?
Dunno. Don't think so. Anyway, it's ages before I turn 18. Why are you going on about it now?
Because it's important. And yes, you do have plenty of time before you're 18. But maybe at least ask Dr. Russell about a transition plan when you get to the clinic. You should know what will happen to your services.
Alright, I will. If it will stop you going on about it.
Hey, I'm trying to help.
Okay.
And I'm going on about it because your transition should really start now.
What do you mean start now?
There's lots of ways you can take control of managing your health condition before you reach 18. I remember when I first started high school.
Ugh, here we go. Not another lecture. You're as bad as Mum.
Hey, listen. This really helped me, and I'm trying to help you.
Sorry. Go on then.
The first change was with my meds. No more Mrs. Logan looking after them and dishing them out to me like in junior school. I had to keep my meds on me, and it was up to me to remember to take them. Obviously, I forgot a few times.
Really? What happened when you missed them?
Luckily, not a lot. I made sure I knew all about them, side effects, what to do when you miss a dose. That's one thing you can do. Learn all about your meds, and you're already starting to take control.
Yeah, I know quite a lot about my meds. Been on them most of my life.
I suppose you know all about your health condition too?
Of course. Well, sort of. I looked it up on the web, but there was loads of stuff that was confusing, and it started to freak me out, so I stopped.
Yeah, well, don't believe everything you read online. You can get yourself into a right mess if you're not careful. I always talked to Dr. Yates at the clinic, gave me loads of top places to get info. Official websites, organisations, even help groups. And when you know about your condition, it will give you more control over it and makes it easier to answer any questions that your new friends might ask.
I haven't told anyone. Well, Mia and Aidan know, but no one else.
It's up to you who you tell. Good friends help each other out. They're like family. So it's good to be able to tell them all about your condition. And you never know. Even you might make some new friends. Anything's possible.
Ah, very funny.
And new friends means new opportunities for fun. Parties, gigs, hanging around the park, drinking, smoking.
Drinking? Smoking? No way! I'm not that stupid. Is that what you did?
No, I'm not saying I did, or that you will either. It's about weighing up risks. If you have a good understanding of your condition and your meds, then you can take control and decide what sounds like a good idea and what should be avoided.
Suppose it would be good to go to some gigs.
Exactly. Anyway, we're almost here. Do you want me to come in with you as usual?
Do I have a choice?
Of course. It's your right. You don't have to be 18 to see the doctor on your own. I used to see Dr. Yates on my own sometimes. It helped show Mum I was growing up, finding my independence. You know, taking control.
Didn't she mind?
Well, she wasn't keen at first, but she got used to it. And she still gave me a lift to the clinic when I missed the bus.
Well, maybe next time. I'll talk to Mum about it later.
Okay, let's go and see Dr. Russell. I'm glad you asked about your transition plan. It seems like they have things under control. Do you understand what Dr. Russell said about your transition process?
Yeah, it makes sense, and I think I'm going to start taking more control. Do some of those things you mentioned, because I've got plans for when I get older. First off, I'm going to learn to drive. Then uni, living away from home, and then some proper travelling. I'm taking control.
You can find out more about the transition into adult services from this booklet.
So I hope you found that thought-provoking. How can you help your child to start to take responsibility for their own needs? Locally, BHT are adopting Ready, Steady, Go, and within Oxford Health, they are employing workers in CAMS and adults to facilitate transition between services. Understanding consent. As a parent carer, it's important to be ready for when your child is able to make their own decisions about their healthcare. People aged 16 and are over are entitled to consent to their own treatment, and this can only be overruled in exceptional circumstances. Like adults, young people aged 16 or 17 are presumed to have sufficient capacity to decide on their own medical treatment unless there's significant evidence to suggest otherwise. Children under the age of 16 can consent to their own treatment if they are believed to have enough intelligence, competence and understanding to fully appreciate what's involved in their treatment. This is known as Gillick competence. There is more information about this on the link in the slide. Some young people with a learning disability will be eligible to be on the Learning Disability Register at their local surgery and have a free annual health check from the age of 14. People with a learning disability can sometimes find it hard to know when they are unwell or to tell someone about it. A health check once a year gives people time to talk about anything that is worrying them and means that they can get used to going to visit the doctor. During the health check, the professional will do a physical checkup, including weight, heart rate and blood pressure. And they might also ask things that can be more common for people who have a learning disability, such as problems with eyesight or hearing. Ask your doctor about the Learning Disability Register. The number of health checks completed is set as an objective nationally in recognition of the importance of these checks for people with learning disability. More information is contained in the following video. This 2-minute video might be helpful to introduction for your young person to their annual health check. You will see this video on the links that we share with you later on. Resources for your child. Here are a range of resources which you might find useful to share with your child, including some short films. There is also an example of route for young people to refer themselves. In this example, for speech and language support at school. What to do if things go wrong. This slide will help you to know what to do if you ever have any difficulty with the health services and want to complain about something or challenge a decision. You will see it mentions Health Watch, PALS and advocacy people, which we saw on the earlier slide about advice, support and regulations. Further information is available through these links to support you and your child. We have the information on SEND local offer for health, Children and Young People's Buckinghamshire Healthcare Services, Buckinghamshire CAMS, the Buckinghamshire Autism Toolbox, How Does the NHS in England Work, King's Fund Animation. Want to influence local health policy? It is a very true statement that change only happens when people turn up. The SEND reforms put a lot of emphasis on the voice of parents being a catalyst for change. The Buckinghamshire Co-Production Charter linked here makes it clear that parents have a key role to play in improving things. It does not require much. Become a member of FACTBucks and respond to surveys or offer comments to questionnaires, or this can be done via the Facebook page. FACTBucks is a group of parents and professionals who meet to discuss real issues that affect children and young people with additional needs and disabilities in Buckinghamshire. It is here to make sure your views and concerns are heard by those who plan and manage the services you or your child or young person rely on. If you have time, you might like to join a parent dialogue group. These meet to help improve key services like CAMS and therapies. They enable parents and carers to be involved in feedback and development of local services. A further group is planned for the neurodevelopmental pathway. Another option is to join a GP patient reference group, which is known as a PRG. Their overall aim is to develop a positive and constructive relationship between patients and the GP practice. The next step would be to represent other parents in strategic discussions by becoming, for example, a committee member for FACTBucks. Bucks SENDIAS service are free, confidential and impartial advice and support service for children and young people aged between 0 and 25 and their parents and carers. Here's the link to our web pages, which are due for improvement. We welcome your ideas. The short video on the link here examples how we work, and it's aimed at young people. If you want to contact us in the future, the easiest way to do so is via our contact form, which you can find on our web pages. If you want a quick response to a general query, you could try our web chat service. Please see the link on our web pages. We currently have 2 sessions a week during term time, which are set. Alternatively, we do have a mailbox and a voicemail service. We aim to provide at least an initial response within 10 days. We have limited availability during the school holidays. And finally, a reminder about FACTBucks, the Buckinghamshire Parent Carer Forum. You will find the links to all of our webinars on their website. It's well worth joining this forum to make sure that your views are heard at a county level.
Thank you very much, Tracy, and for Caroline for that presentation. We should have maybe 5 or 10 minutes to answer some questions, and we've had quite a few questions come through in the chat bar. The first question is from Laura. She says, what is the wait time for Bucks area in terms of paediatricians, SALT and physiotherapists?
Caroline, did you want to answer that one?
I can attempt to answer it. So I think that sorry, just checking. Sorry. So I think it's varied across those different services. I couldn't tell you the specifics. I know that those services are all in, under a high pressure. I think lockdown, like most NHS services, has impacted on that. And throughout the pandemic, when staff were redeployed. So I cannot give you specifics on that. It's the kind of information we can find out. But if you are waiting for a service, then you could always contact that service and find out where you are and when you might be seen.
Okay, thank you, Caroline. And the next question. How do you get referred to these services? Schools state there is no OT, SALT or physio support.
So for physiotherapy, you would need to be referred by your GP or your health visitor or a consultant paediatrician. But for speech and language therapy and occupational therapy, the school can make the referral. You can make the referral yourself. The schools, the therapists offer schools advice sessions as well. So actually there are times where the school can actually speak to the therapist to find out, to have a conversation about ways in which they can support your young person in their setting without a formal referral.
Yes, and we could send out to the delegates today the information about those advice sessions. So that would be available under ordinarily available support. So for children with receiving SEN support, SEND support in schools, there's a lot of sort of less formal therapeutic advice that can be made available to schools, and in some cases directly to parents as well. So I'll make sure you get a copy of that.
Thank you. And what is the wait time for CAMS?
Within, do you want to come back to me?
Yep, Senda.
So within CAMS, the wait time, it gets a bad press because actually CAMS are the holder of the neurodevelopmental diagnostic pathway. So people think there is a very long wait for the CAMS services, but within CAMS at the moment, for depending on the need that you're being referred for, most children and young people are picked up probably within 8 weeks, and often an assessment within 8 weeks. If there is a more urgent need, it might be a shorter time frame, but if it's for a neurodevelopmental diagnostic assessment, we are conscious that the waiting time for that is much longer. There is some work currently being done that will be offering from March some support to children, young people and their families who are waiting on the neurodevelopmental diagnostic pathway, and that has been commissioned and is due to start in March.
Okay, great. How do you join a parent dialogue group?
I think the best way to do that would be for initial information would be to get in touch with FACTBucks. Andrew, I don't know if you're able to comment on that.
Yes, if you want to join a Parent Dialogue group, then the best way to do that is to email admin@factbucks.org.uk expressing your interest in one. There's one for therapists, one for CAMS, one for transport, and soon to be one for neurodevelopmental issues. So if you're interested in any of those, if you just email that address with your contact details, we'll come back to you and follow that up.
Great. Does SENDIAS help support parents applying for a EHCP?
Yes, I'll answer that one. Okay. Yes, so FACTBucks can support parents and young people who want to request an EHC needs assessment. So if you look at our web pages, there's information that you can use to help you to work out what to do, and you can use our contact form that Tracy mentioned to contact us with specific queries. We'll then respond with email information, and in some cases we will be able to offer a call with an advisor to support you through the process. And if you have any challenges with it along the way, so yes, please do contact us if that's something you want to do, and we'll also send you information about all the help that you can have under SEN support.
Great, thank you. How long should you anticipate waiting for a response for an EHC plan?
So if you're making a request for an EHC needs assessment, which is the first part of the sort of journey to getting an EHC plan, there's a 6-week statutory timeline. It could be less than that, but it shouldn't be more than that, where you'd get a decision about whether Buckinghamshire Council is going to agree to assess. And then if they are going to decide not to issue a plan, then they have to let you know that by 16 weeks, and that's from the date of the request, whether you made that or the school or college or early years setting that your child attends. Yeah, and any if you'd like to see the slides, I'm going to be sending those out to you as well at the end of this session today, so you'll have those to refer to.
Thank you very much, Sarah, Caroline and Tracy, for putting on the webinar today. Slides will be provided at the end of the webinar. We will email those to you, as well as a recording of the webinar. If you do have any further questions, you'll be able to contact the Buckinghamshire SENDIAS team via the online form on the website. Links to that will be in the presentation slides as well. So I want to say thank you very much for everyone who has attended, and enjoy the rest of your day.
Thank you.